Hello, everyone. I created an infographic to help with the discussion related to pattern recognition and clinical examples with the featured article by Welk written in 2002. So I thought this was a really interesting article and a very interesting concept presenting a teaching method that I had not encountered before. So in my presentation, I am outlining my objectives to describe what is pattern recognition and to discuss pattern recognition and its use in nursing education, and to identify essential and non-essential features, which I had no idea what that meant until I did some reading and research. And finally, to provide some clinical examples where pattern recognition could be used as a teaching concept to help nursing students. And in my examples, it would be used to help nurses in a professional development program to help them recognize and respond to crises. So to start, I wanted to talk about what pattern recognition is, and in doing so, I looked up the definition of pattern in the Everyday Merriam-Webster Dictionary from 2019. And the simplest, most straightforward definition was that a pattern is a reliable sample of traits. And I liked that definition because of the word reliable that is used, which helps me to grasp this concept where the pattern gives us some idea of what you would expect to see in certain situations on a repeated basis. So I felt like that was one of the key things for me to grasp when I was trying to understand how this skill could be used in healthcare and for nurses. So pattern recognition is an important skill to aid nurses with clinical reasoning, as we have seen in the article. Educators need to create whole patterns when they create clinical examples or clinical scenarios. They need to create a whole pattern with essential features included, as opposed to segments or partial scenarios. So basically, I think it's different than teaching a specific hands-on skill. It's actually an exercise for developing critical thinking. And so you have to present the whole pattern each time you present the clinical example in order for the pattern recognition training to take hold in the nurse's thought process. The other part that I thought was interesting was that repeated exposure to varying clinical examples that include the same pattern or a typical pattern of characteristics related to a medical condition or healthcare emergencies. So in the article, they are focused on recognizing a myocardial infarction. So the pattern is the essential traits, the essential characteristics of a myocardial infarction. So repeated exposure of the learners to various clinical examples, including the same pattern that they need to recognize each time, is what will embed this skill into their thought process. So reading further, I learned about essential versus non-essential features. And I learned that essential meant that the symptom or the characteristic occurs with the highest frequency, and that is based on actual evidence. So there was research done in the article to discover what is the highest frequency symptoms that occur with myocardial infarction. So one of the highest ones they identified was chest pain. Another was restlessness. So you would do that with any health condition or any emergency, is make sure that the essential features included are evidence-based characteristics of the patient's clinical manifestations of a specific health care emergency. So that means that non-essential means that it's a symptom or characteristic that could be part of a clinical picture, and it may even be a risk factor that increases the likelihood of a specific condition. But there is wider variation seen as far as the presence of that specific feature. And so it is not something that is immediately recognizable as part of a specific clinical picture. So I thought about some clinical examples based on my experiences and based on the patients that I see on the unit where I work, which is an acute surgical transplant pediatric unit. So the clinical example 1 is a 5-year-old female, 4 hours post-liver transplant, and she has developed some features of hyperacute rejection, which would be very important for nursing to identify immediately because it needs immediate treatment and intervention. So the essential features of this situation would be a high fever, tachycardia, and significantly elevated LFTs. So non-essential features could include abdominal pain. It could be that the history includes a high-risk donor match and a history of biliary atresia. So these things could be included in this clinical picture, but they are not essential features. And so the nurse would have to learn to identify the essential features when seeing clinical examples related to hyperacute rejection. Clinical example 2 is an 18-year-old male, 1 day post-bronchoscopy in the OR, and he is developing acute pneumothorax, which of course is an emergency. Essential features being difficulty breathing, chest pain, and decreased O2 saturation. And non-essential features, although again, could be part of this clinical picture, but not necessarily, is that he is a 6-foot tall male and slim and has a history of asthma. And finally, my clinical example 3 is an 18-month-old female admitted for a viral illness and is showing signs of an airway obstruction. So essential features would be that she's unable to make any sound or cry, and she's developing cyanosis, usually facial or circumoral cyanosis. And non-essential features would be that she is breastfed, that she is developmentally delayed, and has a history of GERD. Again, those could be part of the picture, but they are non-essential features. So I was thinking about the use of pattern recognition where I work as far as things that we already have in place that utilize pattern recognition that I wasn't really thinking about in the past, but I realized that using the bedside sepsis trigger uses pattern recognition that has been electronically embedded in our assessment tools, and that when we recognize the essential features of sepsis and we use the tool, it triggers us to respond in a certain way by using an algorithm of interventions for rapid treatment. So that came to me as an example of pattern recognition that is used electronically. And I realize there are many, many uses for pattern recognition. Where I work, and most of these conditions could be in various types of healthcare settings with pediatric patients and adult patients. So I was thinking about the use of pattern recognition in recognizing DVT, hyperammonemia, which I've seen many times in liver failure patients, which presents usually with an essential feature of change in mental status that needs to be responded to immediately. Epiglottitis, tracheostomy obstruction, acute kidney injury, acute dehydration, which of course is a significant one for pediatrics, peritonitis, Press syndrome is something I've seen many times in end-stage renal patients. It's usually precipitated by malignant hypertension and can lead to an encephalopathy picture and is a definite emergency. There could be pattern recognition activities using a clinical example of PRESS. Also, bladder perforation I have seen, which needs immediate attention. And I was thinking about narcotic overdose, not so much the situation on the street, but more of post-surgical narcotic use for pain management. And we have often seen the side effects from narcotics that, especially respiratory suppression, where there needs to be an immediate intervention. Pulmonary embolism, and then I was thinking about post-surgical atelectasis, usually caused by immobility and also can be caused by pain medications. So I think there are many, many more examples that could be given, and I look forward to everyone else's examples. So my conclusion is that in the unit where I work, there are many, many areas and types of patients that we could use the clinical examples to practice pattern recognition skills, and that I really look forward to incorporating this concept into future professional development programs as a nurse educator. So thanks for listening.